Here at Middlemore Hospital in South Auckland, they're dealing with the fallout. 580 people are now hooked up to have their blood cleaned and purified by dialysis machines. And the rate of admission is going up by 10% a year, which roughly matches the national statistics. I'm meeting the clinical head of diabetes, Dr. Brandon Walker. Brandon, this looks expensive.
Yeah, no, dialysis is a very, very expensive business. The machines, the very high requirements of staff. It's somewhere in the order of $50,000 to $100,000 per year per person.
Per year?
And that's the dialysis costs. Many of these patients, because of their kidney disease, for those that have got diabetes and other problems, have additional costs to do with the poor blood flow to their feet, problems with their heart, vision and so forth. And so there'll be other direct health costs. But even above that, there is the cost that many of these people are people who could be working, who are now having to interrupt their lives to be stuck on a machine. So it has indirect costs which are far, far greater. It's a huge burden on the health system.
So like fundamentally right now, there may well be millions of dollars of health costs just in this room.
Absolutely.
Just now.
Absolutely. Useful.
Māori and Pacifica are most prone to this disease. It's affecting young and old and is largely obesity related. What's your view about the connection between sugar and obesity and diabetes and all these health problems?
Oh, there's a very clear link between sugar consumption and carbohydrate consumption and diabetes at a population level.
Early intervention could have made the difference, but instead, Middlemore is landed with the high cost of intensive care after the fact. As a clinician, as someone who works with this stuff, how should we, as the general public, think about sugar in our diet?
The simplest of those really is to reduce sugary intake, and the simplest to identify that adds no other nutritional value would be to reduce the consumption of sugary beverages. Are you having much pain in your foot from the operation?
No.
No? So Nigel, Mr. Chan's a patient similar to those we often see in hospital who's got a lot of complications from his diabetes.
Those complications resulted in infections and amputation of his big toe.
But he's also got other complications. He's got some difficulty with his eyes and his kidneys and his nerves.
What do you think caused your diabetes?
Well, in fact, I was taking too much sugar. That's what it happened to me.
Even though I've got a family history of diabetes, you know, to me it was, oh, Mum's taking her pills, Dad's taking his.
Marilyn is 53. She's had diabetes for 20 years and has a long list of related complications.
My retinal have come away from the walls. I've got cataracts forming in both eyes. Yeah, I've had a stent put in.
In your
It
heart?
was last year, yeah.
Coronaries? How often are you having dialysis and how much time does it take?
3 days a week I come, and I'm on 4 hours.
4 hours
for
each
of
time.
those times that I come.
What things now, you know, if you had your time again, would have made a difference for you, do you think?
My diet, eating all these sugary things that I shouldn't have been.
What sort of things were they thinking about just in any day?
I was eating a dozen apple donuts,
Truly?
and eating chocolates and lollies and, you know, heaps of sugar in my cup of tea and
How many
fizzies.
teaspoons?
Teaspoons of sugar, I'd have about 4.
Marilyn, people talk about that you can get addicted to sugar, that you kind of have to have it. Did it feel like that for you when you were having lots of sugar?
I had to have my lollies, you know, the really sweet, like a packet of jelly beans. That amount of sugar is a lot. I had to have it. For me, this is what happened to me with my love of sugar.